Dying matters to me because you only get one chance at death. I have got a background in paediatric nursing and have worked with children with complex health needs, so it's always been important to ensure that children die well, because it is against the kind of natural order of things. And my husband died 2.5 years ago, and it was very important that he died well, not just for me but for our children as well. And he had an incurable condition, so we knew he was going to die from the word go, from his diagnosis. And we were very honest with our children that was the situation, because it was really important to be honest. And I think the overriding thing for me is the need for honesty. And actually the other thing is that for people who've never had any experience of health or social care is actually about knowing what's available to you and what your options are, because most people don't know what their options are, and the word palliative is scary, but actually people are scared to say palliative to people without kind of considering that actually they won't know, and if you don't know, you can't plan for the future, and you can make a decision. If you know about it, you can decide whether or not you want to be part of it, or you can come back to it at a later date, which I think is really, really important. But I read a book that said that we plan for our children's births, and actually we need to plan for our deaths as much as we plan for our children's births. We plan for a good birth, and it should be planning for a good death. There's a really good piece by R.D. Laing, who was a Scottish psychiatrist, in a book called Knots, about people not knowing what they don't know, and other people making assumptions about what they know. And the only way that you can get over the problem of not knowing what somebody doesn't know is by starting at the beginning and telling them everything. And that's, to me, that's like just basic information, because actually when you start a journey through the NHS, you have no idea what you don't know. You know, when my husband was ill, I had an advantage because I knew my way around services, and I knew what services were appropriate to a certain extent, and so I was able to tap into the appropriate services. But so many people don't know what they don't know.